So we have a 35-year-old woman who develops polyuria after pituitary surgery. So whenever you see polyuria after pituitary surgery, the first thing that comes into your mind is diabetes insipidus. Because after pituitary surgery, polyuria and hypernatremia, if there is polyuria and there is hypernatremia, then that is an indication of the diabetes insipidus. Now you see sodium is 148, so it is also pointing toward diabetes insipidus. Please remember, diabetes insipidus is, that is, it is of central diabetes insipidus and it is peripheral diabetes insipidus. In central diabetes insipidus, the ADH is less, and its peripheral diabetes insipidus, ADH is in adequate amount, but it is not able to act on the kidney. Kidney becomes resistant to it. So what happened whenever a central ACD is seen, central DI is seen after the pituitary surgery, and when you have to think about the peripheral DI, diabetes insipidus, whenever you see a patient of chronic kidney disease, whenever you see a patient with hypokalemia, patient of hypercalcemia, in these, or if the patient is on lithium therapy. So these, how will you differentiate? The differentiation is done on the basis of the water deprivation test. In water deprivation test, first you do deprivation, that is, the patient is deprived of the water. When the patient is deprived of the water, what happened to the urine osmolality of a normal person? The urine osmolality of a normal person increases. It is generally more than 600, generally in the range of 700 to 800. In case of central diabetes insipidus or peripheral diabetes insipidus, since in central diabetes insipidus there is no ADH and in peripheral kidney is resistant, so there is no water absorption because ADH generally absorbs water from the kidney. So the osmolality is less. It is less than 300. Now, when you give desmopressin, which is the analog of ADH, what happens in a normal person? In a normal person, there is slight increase of the urine osmolality, because urine osmolality depends upon the water content. If water is more, osmolality is less. Water is less, osmolality is more. So desmopressin absorbs water, so osmolality increases slightly. So there is slight increase in the urine osmolality. In case of central DI, there is also increase in the osmolality, because now desmopressin can act on the kidney are not resistant, so there is urine osmolality increases. But in case of the peripheral, there is no change in the urine osmolality. So when the patient is saying water deprivation test, so urine osmolality of 100, that means the patient is having diabetes insipidus. Now we have to see whether it is central or peripheral. So what we are seeing, that increases to 500 after desmopressin. So there is an increase in the urine osmolality after desmopressin. That means it is a central diabetes insipidus. Please remember, we know that there is CID. You can remember it also by the CCD. That is, in central diabetes, concentration of urine increases when we give